Please pause to read the disclaimer and be sure to stay tuned to the end for a bonus exercise.
So this week is back to school week for us. Our entire county started the school year online for the first week. So I kind of prepped my children for this week. I told them this week we're going to practice patience. We're just going to take it easy. We're not going to stress over anything because this is a setup for success week. So, they'll be a little bit lenient in case there are any problems. My children did great. By the end of the day, I had a headache, and I don't normally get headaches, but when I do, it's usually coming from my neck because I carry a lot of tension in my neck and shoulders like a lot of people do, and those muscles get so tight that it puts pressure on my entire neck area, and eventually I get a headache. So I'm here to get rid of my neck pain, and I figured I'll take you all on the journey with me. I recommend these to my patients as well. Anytime I want to reduce tension in my neck, these are the go-to stretches that I use. And if your headache is caused as a result of neck tightness or tension, we call it cervicogenic headache, meaning that it originates in the cervical region, these stretches can also help potentially get rid of your headache. So before beginning with actual stretches, it's a good idea to take your neck through some basic range of motions. So first you want to begin by sitting up nice and tall, and we're going to begin with neck flexion and extension. And that motion looks like this. This is flexion, bringing your chin to your chest, and extension, extending your head back and coming back to center. Now I want to make a point that when you're doing any type of neck extension exercises or ranges of motion, you want to be cautious if you have a history of high blood pressure or dizziness or fainting or stroke. Consult your doctor before doing these because that can sometimes make it worse. All right, so the next range of motion is rotation.
In normal range of motion, your chin should turn far enough so that it's almost in line with your shoulder.
Now, the next range of motion is called lateral flexion or side head bending. And with this motion, once again, you're sitting up nice and tall, and you're going to bring your left ear to your left shoulder. As far as you can take it, make sure you don't bring your shoulder to meet your ear, right? Just bring your ear over as far as you can, and then back to center, and then towards the right. You should be able to feel a stretch along the side of your neck. All right, so the first exercise is neck retraction. So the neck or chin retraction exercise, it is more of a postural exercise that helps to restore the proper position or posture of your head above your neck. It's a great break if you're using the computer a lot or bending forward in this posture. It'll help to not only relax the muscles but restore that proper posture. So what you're going to do is make sure that your shoulders are back, and you're just going to retract your chin in, hold for 2 to 3 seconds, and then relax, return to neutral position. It's great if you're up against a wall. That way you make sure or you ensure that your shoulders are back. And once again, you bring your chin in, you get that nice little double or triple chin, and then relax. I'm going to do it from the side so you see exactly what's going on. Again, get your chin in and relax. This exercise can help, like I mentioned before, to relieve neck tension in the back of your neck and also create motion. So this is a great exercise to do. I needed to do it immediately. As I brought my chin back, I felt a release in the top of my neck. All right, so the next exercise that we are going to do is cervical flexion. Now in this exercise, you want to make sure you bring your shoulders back and down. And already I began to feel a nice stretch in this area. So we want to bring our neck down and you can hold for about 15 to 20 seconds. You can feel the stretch in the upper portion of your back and also into your neck, and then return to neutral posture. If you want a little bit or a deeper stretch, you can add about 2 to 3 pounds of pressure by gently using your hand to apply pressure on your head and relax. And that helps to stretch out those muscles in the back of your neck. In neutral posture, and bring your chin down. Return to neutral. The next exercise is neck extension. But this exercise is helping to stretch and relieve the tension on the anterior or the front part of your neck. Once again, you want to be in neutral position. Generally, if you have issues with extension, you can always grab a towel and just bring it behind your neck and do the extension that way. That way you can apply some counter pressure so that your neck doesn't overextend. Also, when you are using the towel, if you're using it just for extension, you can just use it to extend your neck. It'll prevent overextension. The next exercise is the stretching of the levator scapulae muscle. Now, this muscle extends from your cervical or your neck down to your shoulder blade, and it pretty much does what it says, levator. It elevates the shoulders. So when you are stressed or at your computer a lot, your shoulders tend to rise up. That muscle is in contraction. In addition to your trapezius muscle, that levator scapulae muscle directly attaches to your cervical vertebra. So this muscle tends to be up when it's under a lot of tension and stretch. When it's under a lot of tension and stress. So this next exercise helps to stretch the levator scapulae. All right, so the way that we're going to achieve the stretching of this muscle is you want to make sure that your shoulder is actually lower. You want to make sure that it's not up. So to achieve that, you can actually stretch your arm down towards the floor, stick it under your side, and just to make sure that that shoulder is lower. Then you're going to bend your head forward and to the side to elongate this muscle, and you're going to use your opposite arm to apply anywhere from 3 to 5 pounds of pressure, gently stretching. I like to call this, for you to be able to remember it, like you want to smell your armpit. Do a pit check, make sure that you are you're fresh under there. So if you are doing the exercise to stretch the left side of your left levator scapular muscle, this is the position. If you want to stretch the right side, and you want to make sure that this shoulder is down, slightly rotate. Oh, that feels so good. And apply some pressure, 3 to 5 pounds of pressure to stretch out that area. All of these exercises, what you do for one side, you definitely want to do for the other side, just to maintain balance. Even if you're not having specific pain on the right side versus the left, you want to do it on both sides. Okay, so the final muscle that is one of my go-to neck exercise muscles, we'll call the scalene. Now the scalene muscle, a lot of people don't talk about it. It's a muscle deep inside of the neck. It actually has 3 parts, and it has a front, middle, and back. We call it anterior, middle, and posterior scalene muscle, and it forms a triangle in your neck. So there are some very important nerves and arteries and veins that runs through that triangle that the scalene muscles make. I won't go into the functions of them all. The brachial plexus, the subclavian artery, and important one is the phrenic nerve. Now the phrenic nerve goes to your diaphragm, and that assists with breathing. So this next exercise we're going to do is to help stretch and relax the scalene muscles. Because there are 3 parts of the scalene muscle, it's important to be able to identify which muscle you're stretching. So with the scalene muscle, if we're going to stretch the muscles on the left side, the first muscle, if you want to put the arm that you are stretching, the side that you're stretching, go ahead and place that arm behind your back, and you want to stretch your neck directly to the side, almost like you're doing lateral flexion, and you want 2 to 3 pounds of pressure here. You'll be stretching the middle scalene. You will feel the stretch right in the center of that neck. In order to stretch the anterior or the front scalene muscle, we're going to rotate our head slightly up, and keeping that lateral flexion, you begin to feel the stretch occurring here in the anterior portion of the scalene muscles. And then to stretch the posterior or the back side of the scalene muscle, you want to maintain this lateral flexion stretch, but rotate your head down, and you begin to feel the stretch or releasing of the muscle towards the back side. And if you want to do that for the opposite side, you put the side that you're stretching, arm behind your back, fix my shirt, arm behind your back, and you can begin with the lateral flexion, but you're stretching just the middle scalene, and 3 to 5 pounds of pressure you can hold. And to stretch the anterior scalene, you just rotate your head up a little bit. Oh, that feels so good. You feel the front of your muscle stretching. And then to stretch the posterior scalene, you just rotate your head down and stretch. Now this is different from the levator scapula because this is more internal, or I don't want to get too technical, but you're more rotating towards this way to get the levator scapula. This is a different set of muscle that we're stretching, and so the direction of the stretch is slightly different. So to review, I talked about basic range of motion when you're having neck pain and headache. Range of motion, taking you through all the different ranges of motion for the neck. We did stretching, neck flexion, extension, are really important ranges of motion to get a deeper stretch. We stretch the levator scapulae and the scalene muscles. I feel so much looser now, and I hope you do too. If you want to see more videos like this, don't forget to hit that subscribe button, and also turn on post notifications so that you're aware when my next video comes out. This is a great exercise to apply some decompressive type traction. And you just hold for 5 to 15 seconds and release.
Remember that this is the position for modified extension. For decompression or traction, angle your towel about 45 degrees upward.